Hi, I'm Dr. William Pleau of Health Touch Chiropractic. This is part 2 of a 4-part series of brief videos about the role of food in health and how to determine what types of food you should be eating to help keep yourself healthy, prevent the onset of chronic disease, and allow you to get more of what you want out of your life. In the last video, we talked about how different people may have different nutritional needs, and that what is healthy for one person may not be healthy for another. Fortunately, there are lab tests that can be helpful in determining which foods you should be eating and which to avoid. But before we get into lab testing, let's first discuss the types of negative food reactions. There are food allergies, food sensitivities, and food intolerances. Some food reactions are mediated by the immune system and some are not. First, let's talk about food intolerance. A food intolerance is an inability to digest components of a particular food. Foods are made up of 3 main types of complex molecules: fats, carbohydrates, and proteins. Your digestive system makes enzymes which break down these complex molecules into smaller pieces. Carbohydrates break down into sugars, proteins break down into amino acids, and fats break down into fatty acids. With a food intolerance, a person lacks the necessary enzymes to break down these food components, and this can lead to very serious symptoms. A classic example of this is lactose intolerance. Lactose is a sugar found in milk. When you drink milk, the lactose is broken down by an enzyme called beta-galactosidase, commonly known as lactase. A person who is lactose intolerant cannot produce adequate lactase, so their body is not breaking down that milk sugar. This causes symptoms of abdominal pain, gas, bloating, diarrhea, and in some cases even vomiting. Food intolerances can cause very uncomfortable symptoms, but they are not life-threatening. A food allergy is different and can certainly be life-threatening. A food allergy is an immune system response to a food protein. Whenever your body is exposed to a foreign protein, such as invading bacteria or virus, your immune system responds to control or destroy that invader so it doesn't kill you. Immune system responses to foreign proteins can involve the production of antibodies, or they can be cellular responses. A cellular response involves the release of special signaling molecules called cytokines by certain white blood cells called T cells. Antibodies, on the other hand, are special proteins made by other white blood cells called B cells. Antibodies attach to specific foreign proteins, which then facilitate the destruction of those proteins by the immune cells. An allergy is mediated by a type of antibody called an IgE, and it produces a very characteristic set of responses. An allergic response will produce immediate swelling, a rash or welts on the skin. It also commonly causes itching of the skin, may producing itching, watery eyes, or runny nose, symptoms we commonly associate with the word allergy. Food allergies can be life-threatening in that they can cause severe swelling in the mucous membranes of the throat. Then the person can't breathe and they can suffocate. Food allergies are often identified by experience. You eat a piece of cheese and your face swells up like the bad guy from Box Trolls. But you can also identify food allergies with lab tests. There are a couple of types of lab tests that can identify food allergies. The old method is called skin prick test, and it involves scratching the skin and introducing a sample of the food in question into the wound. Then if the area swells up and turns red, that's a positive response. Sounds fun, right? The other way is to do a simple blood draw and test for the presence and amounts of IgE antibodies to each of those foods in question. You can also test for the presence of IgE in the stool. Both of these testing methods, the skin prick test and the IgE tests, can be clinically useful, but they're not nearly as accurate as challenge testing, where you actually eat the food and see if you get a response. Challenge testing has to be done in a medical setting, where adrenaline and antihistamines and other drugs are immediately available to stop any potentially life-threatening allergic reaction. In the next video, we'll talk about other types of immune reactions to food. We'll go over the other antibody types besides IgE, and we'll also talk a little bit about cellular immune responses to foreign proteins. We will then discuss other lab methods to try to identify problematic foods. Stay tuned.